The biggest joint pain mistake after 65. One common habit accelerates damage by 6x. Before we begin, let's clearly understand what this video is about, because this could directly affect how well you walk, move, and live in the next 10 to 20 years. The main problem we're addressing is joint damage and chronic joint pain after the age of 65, something that affects the majority of seniors worldwide. The solution we're focusing on is identifying one extremely common daily habit that may be silently accelerating joint damage up to 6 times faster than normal aging. This is dangerous because joint damage is not just about pain. It leads to stiffness, reduced mobility, higher risk of falls, and eventually loss of independence. Many seniors don't realize that once joint cartilage is severely damaged, it is very difficult to fully restore. But the hopeful part is this: if you catch the mistake early and correct it, you can slow down, stop, and in some cases even reverse part of the damage. Now let me ask you something very important. What if the real reason your joints are getting worse is not just aging, but something you are doing every single day without even realizing it? Medical data shows that after age 65, joint cartilage naturally declines by about 1 to 2% every year. That's normal aging. But in many seniors, that rate jumps dramatically to 6 to 8% per year. That means your joints are wearing out up to 6 times faster than they should. Think about what that means for your future. Today you may feel a little stiffness when you wake up. Tomorrow, it could become difficulty walking. And in a few years, it could mean needing help just to stand, climb stairs, or even move around your own home. This is how independence is slowly taken away, and most people don't see it coming until it's too late. This insight comes from experienced orthopedic specialists like Dr. Michael Harrington, who has spent over 28 years treating age-related joint conditions and has worked with more than 12,000 patients. In his clinical observations, he discovered that nearly 60% of severe joint deterioration cases were not just caused by aging alone, but by a single preventable daily habit. Even more importantly, patients who corrected this habit saw remarkable improvements. Many experienced 40 to 65% reduction in pain, better flexibility, and greater mobility within just a few months. That tells us something powerful. This is not just about decline. This is something you can actively control. To understand this fully, we need to look at what's happening inside your body. Your joints are protected by cartilage, a smooth and flexible tissue that acts like a cushion between your bones. This allows you to move without pain or friction. Around the joint, there is also synovial fluid, which works like a lubricant to keep everything moving smoothly. As you age, cartilage becomes thinner, the production of synovial fluid decreases, and inflammation starts to increase. But here's the critical detail most people don't know. Your joints do not have a direct blood supply like muscles do. That means they rely heavily on proper movement to receive nutrients. When you move correctly, nutrients are pushed into the cartilage, helping it stay healthy. But when you move incorrectly, or don't move at all, you accelerate damage at a microscopic level. Over time, this builds up into serious joint problems. Now let's talk about the biggest mistake. The first and most dangerous habit is prolonged sitting. Many seniors believe that resting more will protect their joints. It sounds logical. Less movement means less wear and tear, right? But in reality, the opposite is true. Sitting for long periods, especially more than 6 to 8 hours a day, reduces blood flow, decreases joint lubrication, and causes stiffness. When joints stay in one position for too long, they become less flexible and more inflamed. A recent study found that seniors who sit for more than 7 hours daily have a 65% higher risk of severe joint degeneration. One patient, a 68-year-old woman, believed she was doing the right thing by avoiding movement to protect her knees. But after 2 years of reduced activity, her joints became so stiff that she struggled to walk without support. What she thought was helping her was actually accelerating the damage. The second major mistake is avoiding movement because of pain. This is one of the most dangerous cycles in aging. You feel pain, so you move less. Because you move less, your muscles become weaker. And when your muscles are weak, they can't support your joints properly. This puts even more pressure directly on the joints, increasing pain even further. Research shows that inactivity can accelerate joint deterioration by up to 6 times, which matches exactly what we warned about earlier. A 72-year-old man experienced mild hip discomfort and decided to stop his daily walks. Within 6 months, his condition worsened significantly, and he needed a cane for support. If he had maintained gentle, controlled movement, his outcome could have been very different. Now here's the good news. This damage is not inevitable. There are simple, proven steps you can take starting today to protect your joints. The first solution is controlled daily movement. Even just 10 to 15 minutes of gentle movement each day can make a significant difference. Movement helps circulate synovial fluid, delivering nutrients directly to your cartilage. It also reduces stiffness and improves flexibility. Clinical studies show that seniors who walked for just 15 minutes daily experienced up to 40% reduction in joint pain within 8 weeks. The key here is consistency, not intensity. Start with short walks, gentle stretching in the morning, and make sure you avoid sitting for more than 45 to 60 minutes at a time. Even standing up and moving for a few minutes can help. The second solution is strengthening the muscles around your joints. Your muscles act like shock absorbers. When they are strong, they reduce the pressure placed directly on your joints. In fact, strong muscles can reduce joint load by up to 30 to 40%. This is especially important for your knees, hips, and lower back. Studies show that simple resistance exercises done 2 to 3 times per week improve joint stability and reduced pain in more than 70% of seniors. You don't need a gym. You can start with chair squats, light resistance bands, or even wall-supported exercises at home. The goal is to gently build strength over time. The third solution is reducing inflammation through proper nutrition. Chronic inflammation is one of the biggest contributors to joint pain and cartilage breakdown. Certain foods can either increase inflammation or reduce it. Diets rich in omega-3 fatty acids, found in foods like fatty fish, have been shown to reduce joint stiffness by up to 35%. Adding natural anti-inflammatory ingredients like turmeric and ginger can also help. At the same time, it's important to reduce processed sugars and refined oils, which are known to increase inflammation in the body. Small dietary changes can have a big impact over time. If you've made it this far, take a moment to like this video, subscribe to the channel, and comment your age and biggest joint concern below. This channel is dedicated to helping adults over 60 stay strong, mobile, and independent for as long as possible. Let's finish with something important. Joint pain is not just about discomfort. It determines whether you can walk freely, take care of yourself, and enjoy your daily life without depending on others. It affects your confidence, your freedom, and your quality of life. But the most important thing to understand is this: you are not powerless. By avoiding this one hidden mistake and taking simple daily action, you can protect your joints, reduce pain, and maintain your independence for years to come. Because in the end, it's not just about living longer. It's about living better, stronger, and with dignity. Subscribe now and continue learning how to protect your health, your mobility, and your independence, one simple step at a time.